People addicted to opioids know the struggle of trying to overcome it. An estimated 2.5 million people suffer with an opioid addiction across the country. Numerous people have tried to quit without help, but weren't successful. Others are discouraged by the inevitable, powerful withdrawal symptoms. Many people's success in long-term recovery is directly related to their use of Suboxone. Although it has been an approved medication for use in addiction since 2002, physicians are limited to prescribing it to no more than 100 patients at a time. Medications with buprenorphine, like Suboxone, have proven to be viable solutions for opioid addiction. Suboxone is suitable for long-term use, and the likelihood of addiction is lower than methadone, making the chances of relapse and overdose less. Suboxone is a combination of two medications, buprenorphine and naloxone. Buprenorphine is a partial opioid agonist, which reduces cravings and other withdrawal symptoms. Naloxone safeguards against misuse of the medication by activating withdrawal symptoms when crushed up and injected or snorted. Although naloxone doesn't eliminate the possibility for abuse, the potential for misusing it is significantly lower than that of methadone. Alcohol and other substances should never be consumed when using Suboxone, as the combination of substances can be life-threatening. Subutex, which just contains buprenorphine, has been an effective component of a comprehensive addiction treatment program for many years. It doesn't contain naloxone and is commonly prescribed immediately upon entering treatment, with the patient progressing to Suboxone as a long-term maintenance strategy. While Subutex contains a small dose of opioid, the characteristic euphoria isn't noticeable to people who already have a high opioid tolerance. However, it is entirely possible that it may produce a subdued euphoric effect for those with a low tolerance and therefore can be found for sale illegally outside the appropriate setting. The medically supervised use of Subutex is sometimes mistaken as replacing one addiction for another, despite its proven success for long-term recovery. If used as directed by a medical professional, there is a low likelihood of addiction. After entering a detox or rehab facility, Subutex is commonly recommended immediately to ensure that withdrawal symptoms are safely managed under the supervision of a qualified medical doctor. After treatment, continuing medication may include Subutex. However, it's more likely that it will be appropriate to transition to Suboxone. A study done in Finland found that trying one medication and changing to another if necessary was an effective way to prevent the abuse of Subutex. Be mindful to avoid alcohol and other opioids. Mixing these with addiction medications can be dangerous. Be diligent to using them as part of a comprehensive approach to address and overcome an addiction to achieve long-term recovery. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.